Today let us discuss one very important aspect of low back pain, an aspect about which there are a lot of myths, there are a lot of misunderstandings. So I'm going to be talking about bed rest for back pain, how effective it is, what would be the ideal duration, and how does it really help you. So when we have back pain, the instant response that comes from anybody would be go take some rest. And that rest could extend for months to maybe for a few weeks, but definitely for a few days in most people. So what would be the ideal way of going about it, and what would be the scientific basis behind the bed rest? Now, when I recommend bed rest for a patient, I would recommend it for a period of around 2 to 3 days, especially when the pain is very severe. What bed rest does is it helps in taking off the spasm associated with back issues. Plus, it also prevents movement at the level, as a result of which the pain starts going down. And pain and spasm being involved in a vicious cycle usually, unless one is taken care of, the other persists. So we try and take out one from the equation and the other starts disappearing. So this is the aim behind giving a good bed rest. So most of the time a bed rest is prescribed along with some painkiller and muscle relaxant. So once this end point is achieved, with the spasm and the pain is taken care of, there is no role of bed rest. So usually 2 to 3 days is absolutely sufficient for this. So now what happens when the bed rest is prolonged? When the bed rest is prolonged, the muscles starts losing its conditioning and its tone, and in a way they become weaker. And a weaker muscle is not able to support your back as well as a strong muscle. And in fact, when you look at back pain, the very basis is a back which is weak. So the aim of the therapy should involve strengthening the back. So when the entire treatment is aiming towards strengthening your back, the bed rest per se, especially the one which is prolonged, goes exactly in the opposite direction. And that is precisely why a short duration of bed rest is good enough. And regular exercise and back strengthening would be the core behind treating your back issues. So on that short note, a short rest is what I would always advise, along with some good painkillers and muscle relaxant. Thank you.